All right, today we are jumping back in time, way back to the 1930s, to look at this really fascinating piece of medical history. It's a doctor's opinion, a perspective that completely turned the idea of addiction on its head. And you gotta remember, this was a time when the medical world was, frankly, at a total loss for how to deal with it. So let's get into it.
So everything we're about to talk about really boils down to this one huge question, one we're still grappling with today. Is addiction a weakness? A failure of willpower? Or is it an illness, something physical, something that's actually outside of a person's control? This question right here is the key to the whole thing. And here's the guy who's going to be our guide through all this, Dr. William D. Silkworth. Now, he wasn't just some random doctor. He was the head physician at a hospital that dealt specifically with addiction. So when he uses a word like hopeless, man, you better believe he means it. He's seen it all. This was the grim, day-in, day-out reality for him and his team.
Okay, so before we can even get to the big breakthrough idea, we really have to get our heads around that feeling of complete and utter hopelessness. I mean, for doctors back then, a certain kind of alcoholic, well, they weren't just a tough case, they were basically seen as a lost cause, a medical dead end.
And look, it wasn't for a lack of trying. These doctors had all the psychiatric knowledge of the day, all the tools they could think of. But guys like Dr. Silkworth were just honest. They admitted they were hitting a wall. Sure, they could patch people up, treat the immediate physical damage. But the real problem, the alcoholism itself, they felt like they were making zero headway, absolutely none. And Dr. Silkworth, he saw them all. I mean, he had these different categories for his patients. You had the ones he called psychopaths, who were emotionally unstable. Then you had the ones who were just plain stubborn, totally convinced that this time they'd figure out how to drink normally. You even had manic depressive types. But, and this is where it gets really interesting, he started to notice something. All these different people, with all their different issues, they all shared one thing, one critical symptom that tied them all together.
So, because nobody could crack that core problem, the feeling in the medical community was, well, it was pretty dark. Let's be blunt. Most doctors just figured these people were doomed. That was it. And it's out of this complete despair, this total darkness, that a brand new, kind of radical idea starts to emerge. So Dr. Silkworth is staring at this massive wall of failure, right? And what does he do? He comes up with a theory that just changes the whole game. He starts arguing, hey, what if we're looking at this all wrong? What if the problem isn't in the mind or the morals? What if it's in the body?
And this side right here breaks down his whole idea perfectly. Think about it. For an average drinker, having a drink is a choice, right? You can have one, you can have two, you can stop. Take it or leave it. But for this group Dr. Silkworth called the allergic type, it's a totally different story. The second they have that one drink, something else kicks in, something he called the phenomenon of craving. It's not a choice anymore. It's this powerful, physical demand for more. They literally can't just decide to stop. So here's the core of his theory. He calls it an allergy. Now, you have to remember the time period. We're the 1930s. He's not using allergy exactly like a doctor would today for, say, a peanut allergy. It's more of a powerful analogy. His point is, just like some people's bodies react abnormally to pollen, this type of alcoholic's body reacts abnormally to alcohol. It was a game changer. Suddenly, it's not about being weak-willed. It's about belonging to a distinct physical group of people who are just different. And you can just imagine how this landed with the alcoholics themselves. For the first time, someone was giving them an explanation that actually made sense of their own experience. They knew it wasn't just in their heads. They could feel that something was physically wrong, that their bodies were sick. This idea, it told them, you're not crazy. Your struggle is real and it's physical. But okay, this physical allergy, that's really just the first piece of the puzzle. Because what it does is it kicks off this absolutely vicious cycle, a mental and physical trap that Dr. Silkworth named the phenomenon of craving. Yeah, this is the engine that drives the whole thing. We're not talking about just, oh, I'd like another drink. No, this is an irresistible, overpowering demand that gets switched on by that very first sip. And once it's on, it completely hijacks your brain. Everything else, your career, your loved ones, even your own will to live, it all gets pushed aside. And this right here, this is the vicious cycle. It's a perfect, brutal trap. So, it starts, right? The person feels, I don't know, a little restless, maybe bored. They take one drink. Just one. But bam, the physical allergy kicks in. Now the craving is on. That leads to a bender, a spree, whatever you want to call it. And how does it end? With total soul-crushing regret and a solemn vow, never again, I'm done. But of course, the allergy is still there just waiting, and the whole nightmare is ready to repeat. And this is such a key point.
The doctor saw these guys who had everything going for them, great jobs, families, and they'd just torpedo it all. And it wasn't because they were trying to escape their success, it was because they were just trying to feed this craving that had become more powerful than anything else in their lives. See, it's a compulsion, it's not a choice.
So let's follow the logic here. If the problem is a physical craving that's stronger than your own mind, well, then it makes sense that the solution has to be something stronger than your own mind too, right? Simple willpower just isn't going to cut it.
I mean, just listen to the raw desperation in this quote from one of his patients. This isn't a guy who's on the fence about quitting. This is a man screaming for help. He has every reason to live. He wants to stop, but he just can't. He knows his willpower has failed him time and time again. He knows he needs help from somewhere, anywhere else.
So what's the answer then? What actually worked? Well, Dr. Silkworth noticed something about the very few patients who actually got better. They didn't just try harder. It wasn't about gritting their teeth. No, they went through something he called a psychic change, a complete and total internal shift, a transformation so deep it changed the very way they thought and felt about alcohol.
So here's Dr. Silkworth. He's seen medicine fail, he's seen willpower fail, over and over. But then he sees these miracles, these incredible transformations, and he's forced to a pretty startling conclusion. Whatever this psychic change is, it doesn't come from inside the person. It has to come from something more than just human power.
And this isn't just him talking theory either. To show what he means, he tells this incredible story, a real-world case study of what this kind of change actually looks like. And believe me, it is stunning.
So, picture this. A guy gets brought into his hospital and he is an absolute wreck. I mean, he's lost everything, job, family, you name it. He's physically and mentally falling apart. And he tells the doctor that the only reason he's even still alive is to drink. This guy is the textbook definition of a hopeless case. Okay, so this man gets involved with this new program, one based on what they call spiritual principles. Fast forward 1 year, he walks back into Dr. Silkworth's office, and just look at the difference. The before picture is a shaky, hopeless mess. The after is a man who is calm, confident, and content. It's not just an improvement, it's a total 180-degree transformation. In this final quote from the doctor, wow, it really gets me every time. The change was so profound, so complete that Dr. Silkworth, the guy who saw him at his absolute worst, couldn't even recognize him. Think about that. He wasn't looking at a cleaned-up version of his old patient. He was looking at someone he had never met before, a total stranger. And that brings us all the way back to that first question we asked. See, Dr. Silkworth's big idea, calling addiction a disease, an allergy of the body, did something huge. It took away the blame, the shame, the idea that this was a moral failing. And by doing that, it opened up a whole new path to a solution. A solution that wasn't about being stronger or trying harder, but about finding a power sufficient to treat a deadly illness. And when you think about it, that one little shift in perspective, well, it might just have changed everything.